evening friends, evening everybody. Bache, I am Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hematology, AIMS Delhi. So let us start with our second Prof Pathology strategy session. सबसे पहले, you very well know pathology, but it is divided into three parts: general pathology, hematology, and systemic path. I'll start with the most important of all, that is hematology. Hematology, please put a double star. This will be covered only in path. So do the hematology portion extremely well. Hemat has 4 chapters, that is RBC disorders, bleeding disorders, blood banking, RBC disorders, bleeding disorders, blood banking, and blood cancers or oncohemat. Out of this, the main rank deciding topic is blood cancer, because it will not be covered well in your college also. In college, we usually discuss ALL, AML, CLL, CML, multiple myeloma. Blood cancers is much more than that, and questions are asked in NEET, PG or INI exam. The whole purpose of doing pathology with me is not only to get a good score in your college, but also to have an excellent NEET, PG or INI rank in the first attempt itself. देखो, अगर मेरे साथ फर्स्ट मतलब शुरू से पढ़ने बैठे हुए हैं तो ऑब्वियसली वी नीड टू क्लियर द पेपर इन द फर्स्ट अटेम्प्ट एंड यू आर गोइंग टू हैव एन ऑसम रैंक. जस्ट फॉलो दिस स्ट्रैटेजी. So hematology is important. Then comes systemic pathology. Systemic pathology, lungs, liver, GIT, kidney, CVS, CNS. These topics cover 30% of your medicine also. So systemic pathology. Path and pharma forms the basis of medicine. If you do systemic pathology well, along with pharma, your 60-70% medicine is taken care of. So systemic pathology itself forms about 30-35% of medicine. Do it well. General pathology, to be very frank, is slightly on the lighter side. Now, what is usually seen in the previous 3-4 years is the majority of the top 10,000 ranks. General path, around 10 to 11 questions are asked from general pathology. Top rankers usually are always right in all the questions of general path. They do not go wrong in it. So going wrong in a question of general path reduces your rank. That means general path, of course, has to be studied, and more emphasis has to be laid on the concepts of general pathology as compared to the nitty-gritties. In hemat and systemic path, we'll go to extreme nitty-gritties. We'll see the gene mutations, tumors associated, benign, malignant, this, that, whatever. In general pathology, majority of the stress has to be laid on concepts, because if you know the concepts well, it will be much, much easier understanding the whole topic. Firstly. Next, what is the ideal way to study? Ideal way of studying any chapter is to first have a look at the videos of the same session. Say, suppose you're having a look at inflammation, general path, or you are studying lungs, systemic path, any topic, any chapter. First, have a look at the videos. Do not open your book, whichever book you're following, do not open your book at all. First, have a look at the videos. After that, open your Robbins, because second year is the time when we actually develop a habit of reading. I'm not going to say that you can skip this step. Not at all, bache. Develop a habit of reading. I know Robbins, when usually we start studying, we study 2-3 pages in 2 hours and we don't even remember what we studied. The recall is very low while studying Robbins. So that is where the video sessions, and when you are watching videos, make your own notes. Notes are there on the app. You have the faculty notes, you have topper notes, you will be given the printed notes also. You have everything with you. But make your own notes, because when you are writing with your own hand, now you will have photographic memory. You wrote something on the top, you wrote something lower down, and so on. So make your own notes. You will see that whatever we have covered in videos and whatever you have written in notes is the gist of Robbins. Just flip through those pages of Robbins very fast. If you wish, you can underline those portions also. If not, I am okay with it. I just want you to flip through the same so that you do not fall into fear of missing out at all. You will yourself see that all the topics have been covered in extensive detail in videos and notes. So this notes forms your revision strategy later on. So make your notes well and make them beautifully. Pathology is about colors. You will see that when I'll be writing notes, the main points will be highlighted. They will be with a different color and so on. So make them like that only. After that, after that, go to the race questions. Every topic which is race questions have to be solved. These race questions are the previous year topics which are asked most frequently. And once you do MCQs side by side with the topic, it gives you a much better recall and a much better understanding of the whole chapter itself. So, under no circumstance, race questions have to be missed. Followed by, if time permits, followed by crash course of that particular chapter. Do the crash course of that particular chapter. Suppose lungs, I covered it in 5 hours in full course. Crash course of that is just 45 minutes. So you will be revising 90% of lungs very fast with me in 45 minutes. Do the crash course along with me at that particular time, followed by MCQs of the whole chapter. This is how, if you do this, bache, if you do this, this is the complete set. This is the ideal way. This is the gold standard for doing pathology, and this is the exact sequence. Do this, and I can absolutely guarantee that the success shall be yours. So have a look at the full course videos, make your notes side by side. Open Robins, just flip through those particular topics which have been done. You can underline it if you wish or not. Do the race questions side by side. Crash course. It is 1/5 of the duration. Every chapter, suppose you finished kidney in 5.5, 6 hours. Crash course of that is 1 hour. So it will revise 90% of your kidney, and it will serve as a beautiful recall session sitting with the faculty. Follow it up with the MCQs, and our life is totally set. So this is what I'll suggest for all the chapters. A special stress to be laid on 3 chapters, that is blood cancers in hematology, kidney, and liver in systemic path. You will yourself see that these are the topics which are not covered at all well during your college days. So you will find a lot of extra stuff in our videos as compared to what has been taught in college. So do not think that sir is teaching us extra this, that, nothing doing. What I have taught you is the gold standard. You have to do this. And lastly comes the extra edge videos. In the extra edge videos, I have taken care of the MCQs. So after you have catered to everything, few high yield MCQs, few INI based MCQs, you can do them from the extra edge. I'll keep this slightly as optional at present in the second year, but the other aspects have to be covered well. So on this positive note, do not worry about anything. Second year is still the honeymoon of MBBS. Keep calm, keep on studying, and we are in this journey together. I know easier said than done, but this is actually a fact. We are in this together. We shall keep on meeting. We'll have numerous sessions together. In case you have any doubts whatsoever, my name is Sushant Soni. You can contact me on Telegram. You can contact me on the LN Next, and we'll take care of all your queries. Thank you, and take care.